yourself tangled in the complex web of nursing drug calculations? It's a crucial aspect of healthcare, and yet it often poses a daunting challenge for both nursing students and seasoned professionals. Whether it's a question of dosage, concentration, or infusion rates, getting it right is non-negotiable. This video is here to untangle that web, to demystify the seemingly complex arithmetic, and to guide you through the maze of drug calculations. So, buckle up and stay tuned as we unravel the mystery of drug calculations together. Drug calculations aren't a puzzle when you understand the basic principles. Let's start unraveling this mystery right now. Picture yourself in a healthcare setting where precision is not an option, but a necessity. Here, units play a significant role. Whether you're dealing with milligrams or micrograms, understanding units is crucial in avoiding medication errors. Next, we have conversion factors. Think of them as the translators between different units of measurement. They help us convert from one unit to another seamlessly, ensuring accurate dosage calculations. Now let's imagine a scenario where a patient needs a specific amount of medication. Your ability to calculate the right dose, down to the last decimal, could potentially be a lifesaver. This is where the role of precision in healthcare comes into play. With these principles in mind, drug calculations become less daunting. Remember, it's all about units, conversion factors, and precision. So let's dive deeper into the world of drug calculations. Ready to dive into the practical world of drug calculations? Let's start with the first step, understanding the doctor's order. This is your starting point. The order will typically state the drug name, the amount to be administered in milligrams, and the frequency. For instance, administer 50 milligrams of drug X twice daily. Now, on to the second step, identifying the drug's strength. This information can be found on the drug label or in the drug handbook. It tells you how many milligrams are in 1 milliliter of the drug. Let's say our drug X, is available in a concentration of 20 milligrams per milliliter. The third step is the actual calculation. You need to divide the amount to be administered by the strength of the drug. In our example, you would divide 50 milligrams by 20 milligrams per milliliter. The result is 2.5 milliliters. This is the amount of drug X you need to administer to the patient. A common mistake at this stage is forgetting to check the units. Always ensure that the units of measure are consistent throughout your calculation. If your order is in milligrams and your strength is in grams, you'll need to convert to the same units before calculating. Step 4 is double-checking your work. This is crucial. Even the most seasoned professionals can make a mistake. Always take a moment to verify your calculations. The final step, documentation. Write down the drug name, dose, route, and time of administration in the patient's chart. This is not only a legal requirement, but it also promotes patient safety and continuity of care. Remember, practice is key. Try different scenarios. Use various drug strengths and doses. The more you practice, the more confident you'll become in your ability to perform drug calculations. Also, a handy tip, keep a calculator nearby. While it's important to understand the math behind drug calculations, a calculator can be a useful tool to help ensure accuracy. By following these steps, you can master drug calculations with ease. You've come a long way in understanding drug calculations. We've delved into the heart of this crucial skill, unraveled its intricacies, and simplified it into manageable chunks. Let's take a moment to revisit the key points we've covered. We started with the introduction to drug calculations, where we unveiled the basic principles that underpin this essential nursing task. We learned that accuracy is paramount, and every calculation must be done with utmost precision to ensure patient safety. Next, we explored the fundamental formulas used in drug calculations. We learned how to calculate dosages based on weight, volume, and time. We also discovered the importance of unit conversions in ensuring we administer the correct dosage. We then walked through a step-by-step guide on how to approach drug calculations. We tackled a few examples, breaking them down to show you how to apply the formulas, principles, and techniques we've discussed. But remember, understanding the concepts is just the beginning. Mastering drug calculations requires practice and continuous learning. So don't shy away from those practice problems. Embrace the challenge and you'll find yourself growing more confident with each calculation you successfully complete. Engage with the content, ask questions, and seek clarifications where necessary. Don't stop at what we've covered in this video. Continue exploring and learning, because there's always more to know. Remember, practice makes perfect. Keep practicing and you'll conquer nursing drug calculations in no time.